Welcome to Citizen Athletics. Today we're going to be talking about pinching hip in the squat. Some people will experience a pinch in the bottom of the squat. It's usually primarily in the bottom position, so as they get into the deepest position of the hole, they'll experience that pinch, and then as they come up, it gets alleviated. Some people may experience it ongoing, where it's still this nagging feeling after they've left the hole, but it's usually primarily that deep pinch in the bottom position. This may occur for a variety of different reasons. One of the main ones that's commonly seen is a deficit in this motion called internal rotation. We see that hip flexion, so where our thigh and our chest comes closer together, is highly demanding on hip internal rotation, primarily when our leg stays in line. So if we take our legs far out to the side, such as seen with like a sumo deadlift, this isn't as demanding, but when we do something like a squat where we keep our legs more in line, it's highly demanding on hip internal rotation. As we get into that bottom position, if we don't have hip internal rotation, it's possible that we might be experiencing this pinching sensation due to a limitation in range of motion. How are we going to work on that? Well, we're going to teach you today. Our first recommendation is going to be to temporarily avoid that position. You can think of this as being kind of like a hot spot where you've been poking this irritable region, and we're just going to avoid poking temporarily to let it calm down. To do that, we're going to do two things. Number one, we're going to avoid going into deep squats temporarily, and so the easiest thing you can do is going into box squats and variations of those. The second thing is going to be going into single leg variations. Most single leg variations don't go into as deep of hip flexion in general, but also they give us more room for hip rotation since our foot has more freedom and our pelvis can move more through the motion. The second thing that we're going to do is work on hip internal rotation. So we're going to directly address that through a variety of different means. As we said, hip internal rotation is really associated with hip flexion. So what we'll do is we'll start off with hip extension and work our way into hip flexion. As well, we'll start off with passive drills and work to more active drills and finally going into eccentric variations. That way we can start off with the easiest and least challenging and work our way to the most challenging. So let's check out some of these exercise options. So the first exercise we're going to look at is the prone hip internal rotation. So we're going to be laying on our stomach face down or prone. And from here, we're going to be working on taking the leg into internal rotation. You utilize that one arm, pulling it over to the side. If you struggle with that, you can use a band to help and assistance in getting that over. The second exercise we're going to do is the supine leg knee knocker. This is going to be where we're laying on our back, face up, so supine, and we're bringing the knees into internal rotation. Because the knees are going to make contact, we limit how much internal rotation we go into. We can progress from here into the supine leg crossed drop. So this is going to take us over where we now remove one leg from being in the way, and we can go into deeper ranges of internal rotation. Now we're going to progress into the 90-90 hip rotations. This is going to allow us to get into more hip flexion position. So you can see here in the 90-90, we start off where we're in a bit of hip abduction and minimal hip flexion, but we actually rotate backwards into hip flexion. So you can rotate it back as you feel comfortable. We can use this exact same drill to go into an eccentric. So you're going to lower back slowly and you're going to push down with your back foot into the ground. So this is how we can start to introduce the eccentric motion and have some contraction. From here, for the final exercise, we're going to do a side-lying eccentric hip internal rotation. This position is going to be the most amount of hip flexion we're going to be going into. And it's going to be the most challenging position, and you can use your other foot, the top leg, for providing additional assistance or additional challenge to give you some resistance as you go into the eccentric motion. After you notice your symptoms have calmed down, you've had some time away from it, now it's the opportunity to return back to it progressively. What you can start off with is just gradually reducing your box height, and you can also start to work on getting into some progressive deeper squats. Usually using a tempo is beneficial, slowing down the motion, having some good control into it. Do this over a few weeks as you return back to it, and hopefully you'll be symptom-free. So that was the video on how hip internal rotation impacts pinching in the hips. Comment below and tell us what you want to see next, and make sure you subscribe for more great content from Citizen Athletics.